Alright, welcome everybody. So this will be our first topic that we talk about in your online pathophysiology class. First thing we're going to do is introduce some key terms, basics on cells and how they change, because this is really going to be a foundation as we move through the course for how the body reacts to different disease processes. So some key terms, and after the basics here with this first presentation, the key terms will often be listed in your study guide and in part of your chapter, and you'll just have to look them up and add them to your vocabulary as you're going through the course. We won't spend a lot of time going over key terms or anatomy and physiology, since those are prerequisites for this class. We're just working on now the abnormal pathophysiology of things. Alright, so key terms, pathophysiology, that's just where we're looking at what's abnormal with the body, how is it altering somebody's health and wellness. Pathology deals with what actually has happened to the cells or the organs that have changed. So in other words, what has changed about them that's causing the disease to go on. Morphology is the structure of cells or tissues. Often this is what's altered whenever we have a pathology going on. Etiology means a cause of. So anytime we say in etiology, that means we're looking at the cause. Alright, so for instance, diabetes etiology is elevated blood glucose levels. Things that cause etiology or causes for disease include biological, which means things that already exist in nature, chemical agents such as meds, alcohol, drug abuse, physical forces like accidents or trauma, and then nutrition, whether you're getting enough, too much, or not enough can impact our wellness. Clinical manifestations relates to signs and symptoms of a disease. So this is important. So a sign is anything that someone can observe. It's objective, right? So you can measure it. As a healthcare provider, that means you could count it, for instance, like a heartbeat, or you can measure it with a blood pressure cuff for a BP. Right? A symptom is what the patients report to us. So it's subjective. We can't validate it anyway. We don't know if they're nauseous. We don't know if they have a headache. It's only what they tell us. Sequela is what happens because of a disease. So lesions or impairments that follow because a disease is there. Diagnosis is when we're able to name the disease, so we designate it. We often figure that out by doing things like a history and physical exam, looking at their risk factors, doing testing, lab work, things like that, and put it all together to make a diagnosis. Epidemiology is the study of disease in populations. So how does the disease spread? What does it look like? Is there patterns, trends? Does it only impact certain groups of people? That gives us more information about how we can control it, limit it, prevention, things like that. So for instance, epidemiology, whenever we had the outbreak of Ebola in recent years, and they were very concerned about how it was spread and transmitted and how we were going to deal with it whenever it spread to other continents and countries. Incidence of disease refers to the number of new cases that have arisen. So that is looking at how fast it's spreading or growing. So we're say like in a month the incidence has increased 50%. That means that 50% more people have gotten the disease. Prevalence is the number of people who have the disease in a given period of time. So that's everybody, not just new cases. Morbidity relates to what has impacted somebody's function because of the disease. So for instance, morbidity related to a stroke might be that they lost function of their arm on one side. Mortality is when people die from a disease. When we look at diseases, we're often concerned about preventing them because nobody really wants to get sick, right? So we have levels of prevention. There's primary, secondary, and tertiary. Primary is geared at us keeping the disease from occurring at all. Alright, so what can we do to keep people from getting sick? One of our biggest ones is vaccines, immunizations, right? We give out the chickenpox vaccine, the flu vaccine to try and prevent it from occurring. Secondary prevention is whenever you try and find the disease before it's causing problems in the asymptomatic stage. This is mostly our screening processes for things like cancer. This is why women should get pap smears and we should get colonoscopies so that we can catch the diseases in their beginning stages before they've spread or caused complications. Tertiary relates to someone's had the disease, it's impacting their body, now we're trying to keep them from having further deterioration or complications, so we're treating it essentially using things like medications and procedures. Evidence-based practice is when we as healthcare providers look at how can we use data or research in order to provide quality and effective care. Alright, so we are not just making guesses in the dark, we're looking at clinical standards, research, outcomes, things like that to keep on top of the current trends so that we can keep pace with what's the most recent and the safest practices. Alright, so next we're going to look at cellular responses. So how cells change in response to disease is very important. Atrophy is whenever our cells actually shrink in size. It's usually reversible. What it happens is most of the time when cells aren't being used, they get weak and they get smaller. Right? So the cells can shrink in size, they can shrink in number, it can happen in organs or tissues. Muscles, this often happens. Think about if someone was, a really active runner and then they couldn't run for some reason, maybe they had the flu or they broke their leg, their muscles will get weaker and smaller, they'll lose mass because they're atrophy, because they're not getting used. Right? Usually if a muscle or tissue or organ is not being stimulated or called to be used, or it's not getting enough blood flow or nutrients, then it's going to atrophy. So for instance, as we get older, our thymus gland naturally gets atrophy. It shrinks in size. It's part of the aging process. Your muscles can atrophy, like in Lou Gehrig's disease, or from prolonged bed rest, like people are in a coma or not able to ambulate on their own. That's more of a muscle wasting situation. Glands can also atrophy, especially if they're being stimulated improperly. For instance, like if someone's taking steroids, your adrenal glands can atrophy. Okay. You might have remembered from a couple years back the ice bucket challenge craze, where people were dumping buckets of water on their head for ALS awareness. That is actually a disease of muscle atrophying and wasting. Here are some pictures just to give you some images. If you have your muscle, for instance here, that's nice and bulky, it's healthy and strong. Alright, say for instance somebody might have broke their arm, they had a cast on that for 6 to 8 weeks. When they take it off, that muscle's weak. It's shrunk down because it's atrophy. This is another example. This gentleman had a cast on his hand where he was immobilized for a number of weeks, and whenever they took it off, look at how much thinner and smaller from the muscle atrophy has gone on there. You can also have hypertrophy. So hyper means big or larger, more, right? And trophy means size. So in hypertrophy, we're talking about an increase in the size of a cell, and meaning that it is getting bigger and adding to the amount of functional tissue mass. It's most often from overuse. Don't confuse this with hyperplasia. We're going to talk about that in a minute. Right? But they're two different things, and students often get them confused. Alright, so for instance, one of the most common examples we have of hypertrophy is muscles. So for this gentleman is a weightlifter. You can see how much his muscles have gotten larger in size, so actually hypertrophied. Alright, this is an example of what it looks like in an organ. These are two kidneys. Normal kidney, alright, and this is a hypertrophy kidney. See, it's much larger in size. You can also have this happen in your heart. For instance, people who have chronic hypertension, the left ventricle gets enlarged because it gets tired and has to add more mass to try and constantly pump blood out of the left chamber against that high blood pressure. You can see here how much larger we have hypertrophic cardiomyopathy here than here in the normal heart. Hyperplasia, right? We have hyper larger, bigger, right? Plasia refers to number, right? So in hyperplasia, this is where the number of cells increase. Right, the organ may get enlarged. It's considered a non-malignant growth, which means you have an increase in number of cells, but they're not cancerous. It occurs in the tissues, and it is because it will only occur in tissues with mitotic division, so things like your skin, intestines, glands, things that rapidly reproduce cells. right? It often is because of a stimulus, right? Once we get rid of the stimulus, then it goes away and the overgrowth will stop. So for instance, if you cut your arm, you have hyperplasia of the skin cells while that site is healing. It's also correlated with BPH, which is a common problem of aging men, where the prostate gets enlarged because there's an overgrowth of cells. So that's why it's benign prostatic hyperplasia. Right? It can also be part of a medical condition for women with endometrial hyperplasia, where the uterine lining gets too thick because there's too much estrogen stimulating overgrowth in that area. Metaplasia is where our cells now are getting abnormal, right? There's reprogramming of them, and the cells are now undifferentiated, which means they're not looking like they normally should, right? One of them is going to get replaced with a metaplasia cell, right? And then that metaplasia cell reproduces, and it's going to create even less well-formed cells. And then we keep repeating this process, and we end up with a whole lot of abnormal cells that can't function properly. It's usually a result of something causing a chronic inflammation or irritation to a tissue. If we don't figure that problem out and remove it, then these cells can morph into cancer. So for instance, people who don't treat acid reflux disease are at high risk of Barrett's esophagus. All that acid coming up from the stomach to the bottom of the esophagus will cause chronic inflammation and irritation to the esophageal lining, and then it will cause metaplasia cells to grow there. And then the esophagus gets very red and scarred, and they'll get strictures where they can't swallow their food properly. Smoking also does this to the lungs. Right, so for instance, this is how it can morph into lung cancer from people who smoke too much. Pack-a-day smoker, look how nice and disgusting those look, right? And then this is just the lungs of someone who quit smoking 90 days after. Remove the irritation, the stimulus that's causing the problem, tissue heals. Dysplasia is where we have deranged cell growth. So this is where anything goes. They're not growing the right shape, size, appearance. Nothing is normal about the cell. Right? This is a big warning or precursor of cancer. Right? It's often associated with inflammation and irritation. Oftentimes if we're doing screenings and we see dysplasia cells, we say that the person has had pre-cancerous cells and they remove them. Right? What happens is that these cells are going to just keep replicating and reproducing and making more and more abnormal cells, and then those can turn into tumors. This is what we look for when women have pap smears, right? So when a woman has a pap smear, they take a little scraping of sample of cells from their cervix, and then they look at them on a slide. Now a normal one, you see all the cells are nice, they have the different layers where they change shape, but they're uniform within their layers. Down here, these are dysplasia cells where they're different colors, shape, we have gaps where things aren't communicating with each other, problems like that. All right. Cells can also get injured, which can cause problems and complications. So whenever cells get injured, they can either have two fates. One, they can recover, which means that the injury was reversible, or they don't, and they die, and then it's irreversible. Things that cause cell injury are things like hypoxia, where they're not getting enough nutrients, or the pH, oxygen, things like that are not proper in circulation, so the cells don't get what they need to function. From trauma or physical impacts, chemicals, things like tobacco, corrosive substances. You can also have damage from biological agents like viruses, bacteria, things like that are interrupting our production of function of normal cells. Other things that can cause it are ionizing radiation. Right? These can immediately kill cells and interfere with their replication. This is why we use radiation to treat some types of cancer tumors. And then nutritional imbalances as well. Cells also have a programmed cell death sequence that they go through, and that's called apoptosis, where they know that they're being worn out, so it's time for them to get replaced, and the body naturally replaces them. And then lastly, necrosis is whenever the tissues don't get enough circulation, and then they die off. Alright, and they become